there is to offer anyone who snores. Please join me welcome Dr. Richard Kumson, who is a specialist ENT surgeon at the Trust Hospital in Accra here. Please, Richard, your audience. Thank you very much.
Thank you very much, Dr. Albert Sedo here. And a very good evening to everyone who is listening to this presentation. So yes, my name is Dr. Richard Kumson, and I'm an otolaryngologist, a specialist ENT surgeon. And we have an interesting topic that we are going to discuss today, that is snoring. So without much ado, we are kickstarting the presentation. Okay, so we are going to go through the presentation. This is the outline. So snoring. So most of the times, if we talk about snoring, it is something like an unwanted kind of noise that is produced. Okay, usually it's a harsh sound produced by some individuals whilst they are asleep. And it can be a very disturbing kind of symptom or disturbing kind of sound. And sometimes can put someone in a helpless situation because the person doesn't really know why he snores, but keeps doing it time and time and time again. It is something that has brought tension between marriage couples. But well, the only time that I thought snoring sounded good to me was one time when I had a patient who was quite bad. The situation was quite bad. I didn't know whether the patient would be making it through the night. But then I had a call and I had to rush to the ward. By the time I got there, the patient was lying down. I didn't know what had happened. When I got closer, I heard the patient snoring. And at that point, I was glad. But that's being said, by the way, snoring is usually a disturbing sound and can cause a lot of trouble. Sometimes not just the sound that it makes, but it also can have adverse effects on the health of the patient. Okay, so it's present in about 25 to 50% of middle-aged men, and the male to female ratio is about 2 to 1. Snoring, as we said, it can be harmless, but it also can be very severe with severe consequences. So it is part of a spectrum called the sleep-related breathing disorders. Snoring, which is the normal kind of snoring that most of us know, being on one extreme side, and then the other extreme side, which is more serious and more dangerous, being called obstructive sleep apnea. So when we say apnea, apnea is a situation where a person stops breathing. It's not, taking in or bringing out breath again. Not that the person is dead, but it may be due to one of two things. Either there's an obstruction to the airway so that the person cannot breathe in or out, or there is a situation where the central nervous system doesn't allow the person to breathe. So there's a problem in the central nervous system, and this does not stimulate the person to breathe. So those are the two kinds of apnea that we can have, where a person is not breathing. And snoring can be severe to a point where it can cause you to cease breathing for few seconds, and then you start breathing again. So we also have to look at obstructive sleep apnea if you are looking at snoring. So it occurs when your breathing is interrupted during sleep. for longer than 10 seconds, at least 5 times per hour on the average. And if this is unmanaged, it can give rise to both psychosocial issues and medical conditions. So it can be a very challenging situation to deal with. I remember one patient came to me with this issue of snoring. He said it was so severe that even when he was at work or when he's in a public transport, he is afraid to sleep because when he sleeps, everybody will get to know that he snores, and he snores heavily. So number one, the snore is not making him get enough sleep at night, and during the day, he's also not able to sleep because of the response that he gets around him when he tries to sleep. So you can imagine how stressful this situation is for that patient. So we can see a picture of a couple where the man is sleeping and snoring and is disturbing to the wife. You can see the concern in the wife's face. And this does not just end like this. It may go on to even bring breakups in marriages. There's another picture where you see the wife trying even to obstruct the nose of the husband because of severe snoring. Okay, so we have to consider the sleep cycle if you are talking about snoring. So we have 2 main stages of sleep: the REM sleep and the non-REM sleep. REM simply means random eye movement. So the cycle starts when you are torn in between consciousness and sleep. When you start feeling sleepy, then you move on to the second stage, where you actually fall asleep, and then your heart rate slows down, your brain also does less complicated tasks or activities. And then shortly after that, you enter another form of sleep, which is a deeper kind of sleep, where your body now starts to make repairs. And then the next stage of sleep, you move into the stage where the body temperature and the BP also reduces. Now you are stepping deeper and deeper into sleep. And then you move to the stage we call the REM sleep, where there is increase in eye movements, the heart rate, breathing, BP, and temperature. At this stage, it is interesting because there is high activity in the brain, causing all those kinds of movements. And this is the stage where we normally dream. But it is interesting to know that whilst you are dreaming, you can do a lot of activities, and your eyes may be rolling up and down and all that. But you usually don't act out your dreams, because at this point, most of the muscles in the body do not, actually work. So at this point, there's very high activity in the brain, but then the muscles are very, very, very relaxed. Let me put it that way, as if you are under anesthesia. So you do not move, but then you are doing a lot of activity in the brain. So you can dream, but then you don't act out the dream. And this is a very important part of sleep. We will get to know when we consider snoring in children. So this table also taking us through what we just went through, the non-REM sleep and then the REM sleep. So these are the differences. So we note that in the non-REM sleep, there is minimal functioning in the brain or brain activity. But in the REM, there is a lot of activity in the brain. But it's as if the person is paralyzed. The muscle activity is decreased in the REM sleep. Now we can also note that snoring and obstructive sleep apnea occurs mostly in the REM sleep, the REM stage of sleep. So there's a little anatomy that we are going to look at. So we have normal breathing. If you can look at my cursor, this is the normal a picture showing a person who is having normal breathing. So we have the airway, which is outlined by this blue arrow. That is the blue arrow showing the airway. So this is from the nose, enters the nasal cavity, goes back to the back of the nose. This side is called the nasopharynx. And then goes down. This is still the pharynx. So from the nasopharynx, you get to the oropharynx. Okay. And then you enter the trachea here through the larynx. Now, most of the snoring occurs from the nose right through the nasopharynx. And then when you get this side, this is the oropharynx, because this is the mouth. And this is the tongue there. So this side is the oropharynx. And then you get to the larynx. Snoring occurs when there is partial obstruction to airflow. So this is the normal person. Now, when you get to a person who is snoring, you see that these tissues here have moved back, pressing on the opposite side of the airway, which is the posterior pharyngeal wall. So when this happens, now the air needs to be pushed at a certain kind of force. So it moves with turbulence before it's able to overcome the obstruction here so that you can breathe. And when that happens, it vibrates the tissues around. And that is what causes the snoring. So in the very severe form of this obstruction, that is called the obstructive sleep apnea, you have a very high degree of the obstruction. And so it means that a very high force is needed to be able to overcome the obstruction. So if you don't have enough force generated to relieve the obstruction, that is when you have periods of sleeping without being able to breathe well, called the apnea. And this can have serious consequences as well. So you can realize that sometimes a child can be having snoring, and then it gets to a point that he ceases snoring for a few seconds. So if this is able to happen for about 10 seconds or more, about 5 or more times within an hour when the child is sleeping, it qualifies to be called obstructive sleep apnea. So we quickly go through the causes of snoring. Okay, so as a result of turbulent airflow through the upper airway, the obstructive segment becomes being anywhere from the nose to the larynx. So these are some of the causes. We have septal deviation, hypertrophy of the turbinates. So the turbinates are structures within the nose which can get enlarged and then cause obstruction. So we can have polyps. They are like growths or tumors in the nose or around the nose. You can have the palates being elongated, the soft palates, the uvula being elongated. You have the tonsils also in the throat, by the sides of the throat. Normally, if someone's tonsils are big, when you open the mouth well, the person brings out the tongue and you press down the tongue a bit, you can see the tonsils at the sides, and they can also become enlarged. when the tongue itself is big, and then the jaw itself seems to have been pushed backwards. That is called retronathia. All these can cause snoring. Then we have laryngeal stenosis, which is lower down a bit. Epiglottis becoming omega-shaped or big. All this can cause snoring. So these are the structural causes of snoring. But that is not all. You have other causes or risk factors to snoring. So if you are obese or you have a thick neck, you are prone to having snoring. When you are obese, you have a lot of redundant tissue around the airway, which can easily vibrate and then cause the snoring. So alcohol is sort of a muscle relaxant. So if you take in alcohol, you relax the muscles. Let's go back a bit. So all the structures around here, the pharynx, the tongue has a lot of muscles in it. And when you are awake, it keeps it, it gives it a tone that keeps it open. But when you sleep, all these muscles relax and then it can collapse. Just like you see here, the tongue will move back. The other muscles in the pharynx will all collapse. It makes the place a bit tighter. And then airflow can cause vibrations and then you snore. So alcohol can do that. Smoking also causes inflammation of the lining of the throat. And wherever there is inflammation, there is swelling, there is edema, that's what we call it, swelling. And then this can also give you vibrations and then you cause snoring. So we also have sedatives, sleeping pills, all can make you snore. Old age, and then the position with which you sleep. Normally when you sleep on your back, the tongue usually, when it's relaxed, it will also fall back and then it gives you more snoring. Then metabolic syndrome is when a person is having a lot of different kinds of conditions put together, which include hypertension, diabetes, when the person has cholesterol, issues with cholesterol, as well as having obesity. It has been found that people with this condition normally also have issues with snoring. Now in children, it is mainly due to the tonsils and the adenoids being enlarged. Okay, so when we come back to this slide, just behind the nose, we have this tissue I'm pointing to that is called the adenoids. The adenoids. So just behind the nose in the throat, that is where we have the adenoids. And in children, it can usually get enlarged, and then it can cause obstruction to the airway. Then the tonsils are in the at the sides of the throat when you open the mouth wide. So they'll be around this side, but they can also get enlarged and then they can contribute to snoring. So in children, that is the main reason for snoring most of the time. Occasionally, some children also snore when they have a cold. So obstructive sleep apnea gives rise to two main things we call hypoxemia and then hypercarbia. Hypoxemia simply means you have low levels of oxygen in the blood. And then hypercarbia also means that you have high levels of carbon dioxide built up in the blood. Now, when this happens, hypoxemia will, hypoxemia coupled with hypercarbia, that will stimulate certain kinds of responses in the body, which eventually will not be good for a person who is having this kind of condition. Because number one, it causes, we call something pulmonary hypertension. Pulmonary hypertension. There is constriction of the vessels inside the lungs. And then this one will have an adverse effect to give more work to the heart, because the heart has to pump harder to be able to overcome that hypertension, that high pressure inside the lungs so that you can have your blood going to the lungs to be oxygenated. And when that happens, you will eventually develop what we call heart failure, congestive heart failure, or cor pulmonale. So that is a very serious side effect that can happen with a person who is snoring. Then you also have sleep fragmentation, being the second thing that happens when a person has severe snoring. So please, let's note, it is not any kind of snoring that will give you this. But when a person has obstructive sleep apnea, when a person has serious obstruction to airflow, causing the person to have this periods of breathing stopping for a few seconds during the sleep, then you can develop this hypoxemia and hypercarbia, and then sleep fragmentation. So this hypoxemia and hypercarbia will lead to congestive heart failure, as I said. It will lead to polycythemia. It means that your blood, the bone marrow is stimulated to produce more blood, to produce more red blood cells. And so the red blood cells become more. And this, in effect, may not be helpful to the patient. I talked about hypertension. So this, in effect, will go on to make the person develop hypertension. You have atrial and ventricular arrhythmias. So this is a condition where a person's heartbeat now becomes irregular. A person's heartbeat becomes irregular. So when the heartbeat is irregular, you are not able to pump blood well as you are supposed to. And it all has very adverse effects. Angina is chest pain when you don't have enough blood being supplied to the heart itself. So the heart pumps blood, but then it can get to a situation that it's not having enough blood supplying itself. And then you have challenges, you have problems. So in effect, this is what we call heart attack. Then there is loss of memory. Now, when you get to sleep fragmentation, so usually, especially in children, when you have obstructive sleep apnea, where the child now has very difficulty in breathing, is not able to breathe well, ceases breathing for a few seconds, and then when it ceases breathing and the oxygen level in the blood drops and the carbon dioxide levels go up, the carbon dioxide levels will stimulate the child to wake up so that he can start breathing again. Now, when this happens, the child sort of doesn't have sleep enough to get into the REM stage of sleep. Now, the REM stage of sleep is where you have neural development in children. When a person is born, it doesn't have full maturity of the brain. So sleep is very important because that is what helps us to mature. That's what helps the brain to mature. Now, when the child is not sleeping well, he's in the non-REM stage of sleep. Before he gets into the REM stage of sleep, where there is relaxation of the muscles and then increased brain activity to help in maturation of the brain, then you have obstruction of the breathing, of the airway. And then the child is not able to breathe and then is aroused. So he doesn't have enough REM sleep. And this adversely affects the maturation of the brain of that child. So when the child is snoring, it is not a normal thing. Unless if it is occasional. Occasionally when the child gets a cold and snores a bit, when the cold stops, the snoring stops, that is fine. But when the child is continuously and consistently snoring all the time, every night, it is not good for the child. Health must be sought to be able to treat this child. Otherwise, you have the child performing very poor in school. he has learning disabilities, he has memory loss, poor attention, and he will not do well in school. So this is very important. Of course, it can also decrease a person's libido. And then you have road traffic accidents happening because you're unable to catch enough sleep during the night. So during the day, you have a lot of sleepy times. You are always tired, you want to sleep. If you don't take care, you sleep behind the wheel, and then you can have accidents occurring. So these are the consequences of snoring. So we come to the clinical features. How will a person present? Of course, the history will always include someone who is snoring and may or may not have apneic attacks. So apneic attacks are when the person ceases breathing for a few seconds. And you usually get this from the partner or a close relative of the patient. So you have excessive daytime sleeping in adults when you have obstructive sleep apnea. And then in children, it is the opposite. The child becomes very hyperactive. The child becomes very hyperactive, whilst in the adults, they become sleepy. The child becomes hyperactive. So you also have morning headaches, general fatigue. The person may have nasal speech, memory loss we talked about, and the person may be irritable, always on the edge. Oh, this person is not sociable at all, it's not approachable. It may not be the person's fault. There may be things causing the person to be irritable, and snoring is one of them that can cause that. As we said, in children, they become very hyperactive. You may also see a child who is mouth breathing. So he opens the mouth to be able to breathe, because most of the times behind the nose, there is the obstruction by the adenoids, and it's not able to breathe through the nose. So must open the mouth to breathe. So if you see a child who normally snores at night and is opening the mouth to breathe, has difficulty breathing, it may not always be asthma, as most people may think it is, but the child may be having obstructive sleep apnea. So there may be an obstruction to airflow that is causing the child to breathe through the mouth. The child may fail to try, may not be able to grow well because it's using a lot of force, a lot of energy to breathe every night. The child may be suffering from enuresis, that is peeing on himself at night. Poor school performance, we have talked about it, and then irritability and behavioral issues. So the child is irritable, is hyperactive. Some people may even think that the child has attention deficit hyperactivity disorder, ADHD, which may not be the case, but may be due to the snoring. So quickly through the clinical examination, you can have generally look at the person. The person may appear to be obese. You look out for what we call a syndromic patient. So the person may have some genetic abnormalities that may help you pick up why a person may be snoring. So some of these genetic abnormalities we call Down syndrome. So it's a syndrome where you have the child having some kind of a rounded face. The child usually has a large tongue, and a large tongue usually will cause obstruction to airflow. So there are other forms of abnormalities called craniofacial dysmorphisms. So the person's face seems to have been broken in, and it will in effect cause reduced caliber inside the throat. And so the person will be having obstruction most of the times when the person is breathing at night. When you are elderly, the skin tone is, the tissues of the person is reduced. So the tone of the tissues, the tone of the muscles, they are all reduced. They are all a bit more relaxed. And then this can cause vibrations easily, and then snoring. So if you are 40 and above, you have a higher risk of snoring. Then you also have to do a complete head and neck examination. So looking out for a thick neck, so the circumference is spelled about there, and then examining the structural causes of the snoring as we outlined about in the nose, in the mouth, and then in the throat. So the systemic examination, you have to examine for hypertension, and then signs of hypothyroidism. Hypothyroidism is a situation where a patient has reduced thyroid hormones, and this can adversely affect the person, and sometimes causes the person to be slow and always tired and always sleepy. It may even cause snoring. Okay, so the hypertension, as we said, can be a result of snoring or obstructive sleep apnea. So if you are doing the systemic examination, you're also looking for the causes as well as the effects, because we have congestive cardiac failure here, which can be as a result of the snoring. So when you are examining the patient, you have to look at this as well. Okay, so now we have this picture showing the palate. So this is the oropharynx. So the oral cavity and then the oropharynx of a patient. So we can see these structures at the sides. So these are the tonsils, and these are enlarged tonsils. Usually the tonsils are not so prominent like this, but in this patient, you have enlarged tonsils. You can see how big they are coming to the midline and causing the person to have difficulty in breathing. Then you have the uvula as well. So the uvula here, we can see that also hanging from the midline there. It can also be enlarged and cause snoring. On this side, we can see that the tonsils are very huge and they are even touching each other. This is called the kissing tonsils, and this is a high risk for snoring. Then we have the uvula in the midline there, the same thing in these patients. So they are enlarged. And this is the tongue. The tongue can also be enlarged and then cause obstruction to airflow. So investigations, quickly, we have what we call the sleep study, polysomnography. So this is the investigation that is needed to be able to diagnose obstructive sleep apnea. And the parameters that are looked out for or measured in this sleep study is electroencephalogram. That is an investigation to measure the brain waves of the person when the person is asleep. So this polysomnography is a whole kind of investigation where a patient is put on certain kinds of measurements overnight when the person is sleeping. So they measure the electrical activity of the brain. The ECG is also electrical activities of the heart, electrocardiography. The EMG is electromyography, measuring the electrical activities of the muscles, various kinds of muscles in the body. Pulse oximetry looks at the oxygen saturation of the patient whilst he's asleep. Then we also measure the nasal and oral airflow. We also look at sleep positioning and the BP. All these are measured in sleep study. And it is the gold standard, the required form of study that has to be made to be able to diagnose obstructive sleep apnea. So it can differentiate between snoring, that is just a primary or normal snoring, and then snoring that is severe enough to be termed obstructive sleep apnea. It is not very common. It is not a very common investigation that is easily available, even in the outside world. So in Ghana here, I'm heard of just one place that do it. So it is available, but not very common. But aside that, you can do overnight pulse oximetry, looking at the oxygen levels throughout the night when the patient is sleeping. how many desaturations that occur whilst the person sleeps. Then other investigations also include blood work for metabolic syndrome, and then cephalometric radiographs are taken for craniofacial anomalies. So you have CT scans, MRIs, all checking the structure of the head and the neck. So that is able to help us to see the severity of obstruction that is involved. So management, so we have the non-surgical management and then surgical management. So the non-surgical deals with lifestyle modifications. So when a person with snoring presents, as you take the history and then you do your examinations, you make your diagnosis, how do we help the patients? So the first things to do is to counsel the patient, talk about lifestyle modifications. So which includes exercise and weight loss. This is very important. Exercise has been hammered time and over again. And most of the times we are always procrastinating about exercise. Oh, I will do it tomorrow. I'll do it next time. But it is very important that we take our exercise very seriously. Exercising and losing weight may be all that is needed to overcome that snoring problem that you have. So it is very important. Avoid alcohol, especially in the evenings. As we said, alcohol is a muscle relaxant. And so when you avoid alcohol, your muscles have a little bit of tone to be able to keep it from falling back or collapsing in the airway. And so it helps to prevent snoring. And then avoiding smoking. As we said, smoking causes inflammation of the lining of the throat, the nose, the throat. And so when you stop smoking, this inflammation is no more there. And then you don't have inflamed tissues vibrating to cause snoring. The positioning of the sleep is also important. As we said, the supine position, that is sleeping on your back, normally makes you prone to snoring because your tongue falls back on your throat, and then you have snoring. But when you sleep, it is advised to sleep on your side. So the lateral recumbent position is advised, and this can help to reduce snoring. So as part of the non-surgical treatment, we also have what we call CPAP. I know a lot of us have heard about CPAP. It is called continuous positive airway pressure. So it is a machine that gives a continuous form of pressure to the airway whilst you are asleep, so that instead of the airway just collapsing and then you have the tissues vibrating whilst you try to breathe, this machine will keep a certain level of pressure always whilst you are sleeping, so that the tissues in the airway do not collapse and do not vibrate when you are sleeping. And this can help to reduce or stop snoring, and also reduces or stops the effects of obstructive sleep apnea. So we have here a picture of the CPAP machine that is connected to the patients. They normally put it on the nose. Sometimes you can cover the mouth and the nose, and it gives constant pressure to the patient's airway to open it up. So it is cumbersome, but it is quite effective to stop snoring. All right, so there's another picture of the same CPAP machine. Now the next picture is a newer form of CPAP machine that is coming up. As to whether it is in use at the moment, I'm not too sure. I don't think I've seen some in Ghana, but it is, if it's not being used, it's something that is being developed. And if this becomes a successful device, then it will be very useful and helpful for snorers, because it is very portable. It is not cumbersome as these machines here. And so it will be more easy to comply to its use and to help a lot. It will also save a lot of marriages. Okay, so we have other devices. So that's the CPAP is the first one. The second is we also have intraoral devices. So we have mandibular advancement devices that keeps the mandible forward. So the mandible is the jaw, the lower jaw. So we realize that when the lower jaw is sort of receded or pushed back, it causes obstruction onto the airway. And so mandibular advancement devices will push the mandible forward and create more space for the airway so that you don't have collapse of the tissues there. You don't have vibrations to cause snoring. So the tongue retaining devices also, they keep the tongue in the anterior position during sleep. So this also helps to abolish or improve snoring. So this is the mandibular advancement device, an example of it. And this applied in the patient. So the patient usually wears this at night when sleeping to be able to prevent snoring. Then this is also the one for the tongue that keeps the tongue anteriorly so that it doesn't fall back to cause snoring. Then the surgical management, you have surgery that can be performed in the nose. We have septoplasty, we have endoscopic sinus surgery. All these are to help structural abnormalities in the nose. So if the septum is deviated and therefore causing reduced airflow in the nose, you can have surgery to help to make it straight and then open up the nose to be able to have free breathing. Then you have in the palate, you have UPPP, so uvulopalatopharyngoplasty. Simply put, it is surgery on the uvula, that is the uvulo, the palato is the palate. So the uvula, the palate, and then the pharynx. So the uvula, the palate, and the pharynx. You have surgery to trim it up because snoring most of the times occurs at this point where you have vibrations of the tissues there. So you can have surgery to have that side trimmed so that you don't have a lot of vibration there, and then it will help to prevent snoring. This, as we can see, is a more aggressive and radical form, but it's extremely effective. So yes, no, we have the uvulopalatopharyngoplasty, but then a more aggressive and radical form is what we call the maxillomandibular advancement, maxillomandibular advancement. So the mandible, as we said, is the lower jaw. Now the maxilla is the upper jaw. So we see that the upper teeth are on the maxilla. So the upper teeth, your upper teeth is sits inside your maxilla. So that whole side of the face above your upper teeth, so your cheeks beside the nose, that's all the maxilla. Now this surgery, you are going to move all this forward. So we can see that it is not an easy surgery. It is an extensive and aggressive surgery. It is effective, but it has a lot of morbidity attached to it. So it is not very a common surgery that is done a lot of time. Then in children, we have adenotonsillectomy. So adenotonsillectomy is when the adenoids and the tonsils are removed. The adenoids and the tonsils, when they are enlarged, causes obstruction. And that's a common cause of snoring and sleep apnea in children. And so surgery to remove them usually helps to treat snoring in children. Then a last resort is tracheostomy. Tracheostomy is when you make you make an opening into the trachea or into the airway from the neck. So you make an opening into the airway from the neck, and this will bypass all the obstruction to airflow that you can have. So I'll show you a picture of it very soon. So this is a tracheostomy in a child, all right? And so you have a tube going into the neck. And if you look at the level, it is below the level of the larynx. So the tube goes into the neck like that, into the airway, into the trachea. And so it has bypassed all these areas, the nose, the oropharynx, the nasopharynx. This side is the laryngopharynx. It's just close to the larynx. So all this side, that is where you normally have the tissues vibrating and the obstruction to airflow, causing snoring. So the tube can bypass all this. Usually, this is not very common surgery that is done for snoring, but usually in children that have some neuromuscular problems that are not able to even control their breathing by themselves, that may even need support, they will survive with the tracheostomy for a while until they develop enough control over their muscles to be able to breathe on their own. All right. And sometimes a person can even have an accident that can affect this airway, is not able to breathe well. You give the person tracheostomy to keep the person alive for a while, and then later the tracheostomy can be removed. But in children, this is a last resort. Usually it is not for just snoring, but other severe forms of conditions that may need to keep the child alive. But yes, it will bypass all the areas that causes snoring. So if it's a very severe form of snoring that is causing all those adverse effects of congestive cardiac failure, causing pulmonary hypertension, and the child is just slipping away, you can do tracheostomy to be able to keep the child alive and then help the child to treat whatever is causing that, so that later the tracheostomy can be removed. Okay, so in this picture we see the nose. We can see that this side of the nose is almost closed off because the septum has shifted to the right side. So septoplasty can be done to keep the septum straight and also to be able to open up the nasal cavity so that there can be free flow of air in the nose. So these are some of the causes of snoring, which can be treated with surgery. So in the palate, the soft palate, the uvula, we can see that this is the uvula, this is the tonsils. So the uvula, the soft palate. When you come forward a bit, you have the hard palate. So the uvula, the tonsils, the soft palate, parts of it have been removed. So the tonsils have been removed, the uvula has been removed, parts of the soft palate have been removed. This is usually the places where you have vibrations to cause snoring. So in this picture, all has been removed, and usually it can help with snoring, but it also has its own side effects, because now you can have problems when the person is eating, can have problems of having regurgitation of the food. Now the food now passes back through the nose and comes outside. So if care is not taken, you can develop that complication after this surgery. It is quite an extensive surgery as well. Personal local experiences with this surgery at Kolebu showed that they didn't get very good results from this surgery to help solve the snoring problems of the patient. So it is not usually done. It is not usually done in this part of the country. So then it means that the devices, these devices, aside the treatable structural causes in the nose, these devices help very well to be able to manage the snoring problems of most of the patients. Yeah, so these devices, there are also places that it is available here in Ghana. They may be a bit expensive, but they are available. Okay, so in the end, snoring can be a very difficult situation for most people, but there is hope for all those who snore. So don't just stay at home, but seek help and you can have solutions to the snoring problems. And more importantly, always be mindful of a child who is snoring and who keeps their mouth opening. It is a very, very common condition in this part of the country. In fact, worldwide, it is very common and it is a treatable condition. If you just ignore it, you are causing more harm to the child. Academics, behavioral, it is going to cause systemic problems, heart problems. Please be very mindful and help all those children who are snoring to have treatment. Thank you very much.
Thank you very much, Dr. Richard Coulson. We appreciate your extensive presentation. You covered everything about snoring. This is very, very detailed. And if you know someone who snores, you know there is help. But you also need to understand and be mindful of the take-home message. Snoring can cause hypertension. Snoring in children can cause memory problems, poor academic performances. It can cause discord in marriages. It can cause serious problem in relationships and marriages. And you need to see the ENT surgeon, and there is help available for you. There are a lot of complications that snoring can result in. So if you know someone who snores, if you snore, most often than not, you don't know that you snore. It is most likely anyone who sleeps close by you, your partner or relative, who can tell you. And when they do so, please don't doubt them. It is true you are snoring. So just go to the hospital and let them seek help for you. For children, like he said, enlarged tonsils and adenoids are one of the common causes, and there is help available. So, reason for this presentation is for you to hear from the experts on the field, so that you know that what you are hearing is the truth. Let no herbalist or spiritualist tell you that your snoring is caused by your grandfather or your grandmother, your witch. Nobody, no. He has taken us through all the things that can possibly cause snoring and all the things that we can do. The preventable ones: avoid alcohol, exercise, and all the things that he shared with us. Very, very detailed. We have 5 minutes for any questions that anybody might have. We have 5 minutes. If you have any question, please quickly type it in the chat box right now and let him answer you. You have 5 minutes. We are way beyond time. So we have 5 minutes to take any questions so that he can quickly answer for you. Please put a question in the chat box in the comment section on YouTube, and he will gladly respond. Thank you very much, Dr. Coulson, for taking time and making us understand all these details. And I'm happy you give us that there is help. And the instrument, the CPAP machine, and the other ones, they are available here in Ghana. Thank you very much. If you have any question, put in the chat box. For me, all my questions have been answered, all of them. I don't know about you, but all my questions have been answered. So if you have any question, please feel free, put in the chat box. If you know somebody who snores, get the person to see the ENT surgeon, and the right amount of help will be provided. Thank you very much. I think nobody has any question, which means, Dr. Richard, you took your time and took us through thoroughly. We all understood everything, and now we have full knowledge of what we need to know about snoring. We appreciate you so much. Thank you, thank you, thank you, thank you. Everybody on the call, please join me to say a big thank you to Dr. Richard Coulson. He's a very, very busy man. I had to corner him, and he sacrificed to be here with us. We appreciate you, Doc. Thank you very much for making time for us. Thank you very much. We appreciate you. And to the rest of us, thank you very much for making time to join our call. Until I come your way once again, have a nice day. Once again, it's been a plum pleasing pleasure serving you all.